The procedure that I do the most in day-to-day practice is a class 5 gingovectomy and a class 5 composite. And I do about 2 or 3 a day, and maybe a few more, but I think everybody will agree that that's a really common procedure. The advantages of using a Biolase laser, well, one is if we use the Biolase laser, there's no vibration, meaning the patients won't feel the vibration of the drill. The laser actually stays about 1 millimeter, 2 millimeters away from the tissue. The other advantage is they don't hear the drill. They don't hear the high whine of the high speed. They just hear a slight tapping noise. The other advantage is it's incredibly conservative. The laser takes away very small amounts of tissue. So the way I actually use it is this. I give a little topical anesthetic. Sometimes I will give an anesthetic if it's a deep class 5 lesion, but normally just topical. Then I take the Biolase laser and I press a preset, one preset. I begin to do the gingivectomy. Then keeping the laser in my hand, I do another preset, just pressing a button. Then typically I'll take away the composite, I'll take away the decay, and then with the same handpiece still in my hand, I'll bevel the margins. After that, we keep the handpiece in my hand, we press one more preset, and we'll take away the smear layer, which is a really valuable part of the laser because it magnifies the retention of the bonding agent. Then, typically I just bond and fill as I would normally. Some of the other treatments I utilize the laser for, there's a whole host of them. Crown lengthening, hard and soft tissue, frenectomies, mucoosseous surgery. I do some biopsies with it, and I do a number of hard tissue. I do class 2s. My favorite is a class 3 and a class 4, an anterior composite. I have not given an anesthetic for a class 3 or class 4 I've had the laser for 18 years and probably 17 years. They don't even set up for it anymore. I can do 3 or 4 class 5 composites, class 5 composites or class 4s or class 3s in the amount of time it takes me to get a patient numb. Phenomenal thing for an anterior. The Biolase laser helps us conserve tooth. It's very pinpoint accurate. It's a very slow, methodical removal of decay, and if you're using magnification, it's incredibly accurate. And I always remind them that they can eat, they can do anything they want the minute they leave this office. And for a doctor, there's no better patient walks out that can do that.